My name is John Parker, and I'm a spiritual care provider at Amari Hospice. So my role as a spiritual care provider is to go and meet with patients and families and discover about what they believe and how their faith practices affect their life. And so, as you can imagine, families have, husbands and wives can have very different views of faith, as well as children and parents. And so to help gather that information so that the team can provide care for both the patient and the family in ways that are meaningful and helpful to them as they go through this challenging time of life. I chose hospice to work in that profession because of my love for people and a desire to equip and empower them to live life to the fullest and to be able to walk with people through times of trials and help them be equipped for what's to come in life. I think what I find most meaningful about helping patients and their family is to be able to come alongside, to listen, and to hear what they're struggling with, and to provide words of wisdom, encouragement, and also to give them resources that will help them in their journey to prepare for what's to come and to live the highest quality of life. For me, I come at it from a point of like an investigator. As you can imagine, everybody has a different faith and a belief system, even within a particular faith group. And so my role in this is to really discover what's meaningful and helpful for them, and to provide resources and to help them really tap into what is going to bring them peace and joy and hope. And also to negotiate the differences, because there are conflicts often between husband and wife or children and the patient of what they want and desire, and to help them to come and reconcile on how they might live harmonious together and support one another in this time. There's frequently times where I get to sit at the bedside of someone who's passing with family gathered around. And where I can offer a prayer or words of encouragement to them. And so that's kind of one of those meaningful times to do that. I think one particular time I had with a couple that I knew, I was at the bedside of the mother when she passed away. They had two 8-year-old twins that were in school that day. And then that day we went out to the school to pick them up and then bring those children back home. And we discussed about an opportunity to give those children a choice whether they wanted to see their mom after she had passed or not. And one of the things that we often don't think about is with children and death and dying, we tried to shield them from that. And rather than a child going to school with the mom alive, and then the next time they see them, they see mom in the coffin and they're putting her in the ground, they can't make that transition. And they don't have the categories of what does that mean? Why are they burying mom? Last time I saw her, she was alive. But when they can come to the bedside and see there's no life, there's no breath, they begin to learn what death and dying is in a way that's helpful to them to say, you know, we grieve mom passing, but when they see that coffin going to the ground, they know that there was no life in their mother. So that was a touching time. Hospice care is about living the highest quality of life for as long as we have it, to support and to provide that care and love in meaningful ways. And I think one of the things too is for people not to be fearful of it, but to have that support come on as early as possible so that patients and families can get to know the team. Because what I often see is people say, I'm fine, I'm fine, I'm fine, until they're not fine. And then they're in a crisis mode. And then it's all of a sudden you bring in the crash cart and you bring in all these people and it's overwhelming. And so if they were to get on hospice earlier and get the full benefit of hospice, they would really experience much more blessing and support and peace and calm rather than trying to do it all yourself. And that way, I think also husbands and wives and kids can actually be husbands and wives and kids in the role and utilize the support that hospice can provide. Everybody has a different faith or perspective of life, even within different faith groups. And so my role is to really to glean and listen to what their beliefs are and what brings them peace and comfort, and then to share that with the team members so that we can care for them in a way that's meaningful to them. And so it's not about pushing any agenda of a particular faith group, but it is discovering what's meaningful and helpful to them in that process. To be able to come in at a time of crisis in a family's life when they're overwhelmed and emotionally maybe just kind of tapped out, and we can provide some wisdom and support, help process through the things that they may not have thought about, and really come along and love and care for them in meaningful ways as they face a very difficult time.